Hello and welcome, everyone. Thank you for joining our monthly Hunger, Nutrition, and Health Action Collaborative webinar. I'm Rachel Forensic, and I'll be your host today. I want to let you know, first of all, if I'm going to be on screen. Okay, feel free to introduce yourself in the chat. The chat is now open. Feel free to introduce yourself and your organization, and during the panel discussion, we'll close the Zoom chat. Many of you asked for the chat to be open so that you can share resources and information that might be of interest to others. We will open it at the end and after the panel and during the Q&A. Just another reminder is to please don't post any political commentaries or sell any products. At any time during the webinar, you can submit questions for the panel using the Q&A feature. So now we're going to launch our Zoom poll, our first poll, which we always ask folks what type of organization you represent. We like to know who's here. So we'll give you about 20 to 30 seconds to do that. Okay, why don't we go ahead and close that poll. As usual, we usually have strong representation from community, nonprofit, national nonprofit. Great to see academic health system and a strong showing from state government agencies. So thank you for sharing that. Okay. All right, well, let's jump in. Today's webinar is both about the importance of good nutrition before, during, and after pregnancy, and about an action network that is working to catalyze engagement across sectors and drive health impact through partnerships. Today, we are joined by three special folks. First, Dr. Kent Thornburg, Professor Emeritus and Founding Director of the Moore Institute for Nutrition and Wellness at Oregon Health and Science University. We have Anna Corona, Senior Specialist, Child and Adolescent Health Systems Building with the Association for Maternal and Child Health Programs, AMCHP. And Krista Lumpkins-Howard, a doula and the Senior Director of Training and Community Impact for Birthing Beautiful Communities in Cleveland, Ohio. Kent, Anna, and Krista are also founding members of the Hunger, Nutrition, and Health and Pregnancy Action Network, a subgroup of the Hunger, Nutrition, and Health Action Collaborative. All right, well, welcome to you all. It's so nice to have you here, and thank you so much for being a part of this conversation. Let's go ahead and jump in. Kent, it is important that you help us set the stage today for why this topic matters. I recently saw a quote of yours that I think sums it up perfectly. The quote was, "How you grow before you are born matters." Can you unpack that for us?
Thank you. First of all, thank you for allowing me to be on this program today. I'm very excited about the conversation that I'm expecting to hear. I want to start and go back 30 years when David Barker at the University of Southampton in England discovered that people born at the low end of the birth weight scale, like 5 pounds and smaller especially, have very high risks for having cardiovascular disease and dying of the disease. And since that time, we've discovered that birth weight matters and that people born at the high end of the birth weight scale have the same kind of risks that babies that are born at the other extreme, really low birth weights. Well, that led us to a lot of study around the world. And what we discovered that there are stressors that can occur before birth that can, most of which reduce birth weight. And these stressors include malnutrition for the person who is pregnant. And it also incurs exposure to toxic chemicals. Some of those, by the way, are in food that people eat or in the plastics. And also social stress. And I'm talking here about toxic stress. People who don't know where their next meal is coming from, where they're housing insecure, whether they're abused by other people, a spouse especially. All of those chronic conditions lead to an increase in cortisol in the blood. That crosses the placenta and affects the way the baby grows, particularly the baby's brain. So that we now know. What we've learned since David Barker made his discovery is that the way we grow before we're born is affected by the environment we're living in. And part of that environment is the maternal nutrition environment. And by the way, let me add that we also know that there's a paternal effect, a father effect, that comes through the sperm. But since babies grow in the womb, they're exposed to the nutritional environment, and that nutritional environment that they're exposed to will change the way their genes are regulated, and that puts them on a trajectory all the way through childhood into adulthood. So what we now know is that nutrition in people who, before they get pregnant, during their pregnancy, during infancy and lactation, are incredibly important for building the epigenetic background. And epigenetics is the mechanism by which these stressors actually affect the way genes work in the offspring. So this is a pretty exciting field right now, and I just want everybody to know that this has been important for us. And the Moore Institute had 3 convenings that we tried to help unpack all the information I've just now told you. And the first one we did was on nutrition in pregnancy, and that included pre-pregnancy and lactation thereafter. And it turns out that we published a paper on that, which is highly cited paper. People are excited to have a document that they can read about nutrition before pregnancy. The second convening we had was related to deciding and understanding the barriers that prevent people who are pregnant from having good nutrition. Now, those barriers are really important, and we came up with the top 10. And unfortunately, I kind of left that second meeting feeling like we were unfinished. I mean, what good does it do just to say what the barriers are? So we had a third meeting, and that third conference, thankfully, some people on this call were present for. And at that third conference, we asked, what can we do to overcome these barriers? That's where we are now. And the outcome of that is the network, the action network that we're in talking about today. And I think now I'm very excited that now we have a way to talk about this and move the field forward.
Awesome. Thanks, Kent. I know you just unpacked a lot in a short period of time, and I have no doubt people are going to have questions. So we'll make sure we gather those. And if there are any supplemental materials that people that might help support some of what you've been talking about, we'll make sure to get to the audience. So I know that was a lot in a short period of time. So thank you, Kent. Anna, I wanted to turn it over to you because you've been a partner in the Action Network since the beginning. And I wanted to know if you can tell us why this network is important to AMCHP, and how have you leveraged the collective strengths and resources of other network members to further your work?
Sure. And hello, everyone. It's so nice to be here with you all. Thank you for inviting me to join this conversation. And I'll just quickly start off by saying, for those of you who aren't familiar with the Association of Maternal and Child Health Programs, or AMCHP, in a nutshell, we're the National Professional Association for leaders of Title V maternal and child health programs across the country. And partnerships is actually one of the 4 pillars of AMCHP's strategic plan. And, we really view intentional and strategic partnerships is a critical ingredient for how we really strengthen the support that we provide for our members in all of our 59 states and jurisdictions. And for just a little bit more context about who our members are, Title V maternal and child health leaders are really operating on what I call the front lines of improving maternal and child health systems across the country. And increasingly, that means addressing really complex issues like those that Kent alluded to, like food insecurity, that really impact pregnancy, pre-pregnancy, and then a child's trajectory for life. And so we know, and of course our members know, that they can't do that really complex work alone. And so as we think at AMCHP of ourselves as a national connector and a capacity builder for our members, so we see it as our role and our responsibility to broaden our own range of partners that we're connected to, so that we can bring fresh ideas, we can learn from expertise and connect our members directly with the resources that our partners that we develop relationships with have. And I think really that's in a nutshell why the network is so important. It's allowed us to expand our own reach at AMCHP, deepen our own organizational understanding of the food and nutrition landscape, and overall just really provide higher quality to support to our members, again, who are charged with improving maternal and child health outcomes in their states and jurisdictions. And to answer that second part of your question about, how we've leveraged this really wonderful connection that we have to this group of folks in the network, to give you a concrete example of how we've done that, AMCHP is currently leading a project that is focused on supporting leaders of Title V programs and their partners in several states to develop and implement a policy initiative that is specifically focused on increasing access to nutritious foods for maternal and child health populations. And for that project, we convened a subject matter expert council, of which some of the members that now make up that council were directly recruited from this network, which is really exciting because and I'll mention this a little bit later in our conversation. Some of these partners we had never known before the network. So what this subject matter expert council is going to do for this project is provide, one-on-one expertise and consultation to the folks at the state level who are really rolling their sleeves up and thinking about the partnerships that they need to build, the policy initiative that they want to really focus around, and really start to support the implementation of that policy initiative.
Thanks, Anna. Let's keep this theme going. Krista, you have also been here since the beginning, and I'm constantly amazed at what you both can see and the opportunities that you seize when it comes to collaboration. Can you tell us about any partnerships that you've created because of being a part of this group?
Absolutely. Well, happy Wednesday, everyone. I am Krista Lumpkins-Howard out of Cleveland, Ohio, with Birthing Beautiful Communities, and we're an organization of doulas, birth workers, and mental health therapists who support our clients here in Northeast Ohio, one birth at a time. And I can honestly say this network has expanded our reach. One of our goals is to connect the dots of life for our clients, and you all have allowed us to connect some dots that we were not connecting initially. And so because of that, we now have partnerships and relationships with a variety of organizations across the United States, and having learning opportunities that really have allowed us to educate and advocate for our clients better. So super, super excited and grateful that we are a part of this network.
Thanks, Krista. Kent, let's also hear from you. Why is this Action Network important to you and your colleagues at OHSU? Oh, Kent, you're on mute.
Thank you. Let me just say that this is a dream come true, because we have to face it that we will not change the health of people who are becoming pregnant in this country without a really big push from all kinds of organizations. It will not happen otherwise. And what I didn't say very strongly when I was talking before is that poor growth before birth is responsible for maybe 60, 70% of all chronic disease in this country. So if we want to reverse the rates at which people are getting chronic diseases like heart disease, lung disease, obesity, diabetes, and these conditions, we will have to change the way we grow before we're born, and that is important for the future generations. So this organization gives me hope that we can broaden our scope to include everybody who wants to have a voice in this big question that we have that needs to be sent to policymakers and to people who can really make a difference in this country.
Thanks, Kent. Yeah, this is really a really important strategic time that a lot of attention and work we need everybody devoted to because it has a really big impact. Krista, I wanted to come back to you and ask you, looking ahead, what are the most pressing gaps or opportunities for improving nutrition and health outcomes from preconception through early childhood?
Absolutely. So I would start with culturally rooted preconception health programs. I'm working on educating prior to conception, as well as advocacy. We have got to advocate now. Changes are happening, and we've got to get our voices out there and really just start leading the charge that way. Also, what about making sure that equity includes parental leave? We got to fight for that. Like, that is one of those things that is out there. And postpartum nutrition education. A part of postpartum depression comes from the nutrition component and lack thereof. So the education piece really allows, like, we've got to get that word out there and let people know, like, hey, these are things that are going to change every aspect of your paternal and maternal outcomes. We really have been working hard with our fathers as well as our doulas. So we educated the doulas through the Lifestyle is Medicine course on proper nutrition, and they in turn educated clients. But then we took it a step further. So now we're cooking with dads and really wanting to make sure that dads are a part of that process. And if there isn't a dad, then what does your support system look like? So now community support programs and incorporating infant massages and things like that. So we're starting just one program at a time, but making sure they're culturally rooted so that people really feel comfortable with the information they're receiving.
Great, thank you. I heard that message loud and clear. Culturally rooted, really important to really grab people and make them want to participate, be involved. All right, Anna, how can this action network further unite organizations to drive systemic change and realize the vision of ending hunger and building healthy families?
Yeah, I think of this question really practically, and I will say we, as the network, I'm going to brag a little bit on the network and hopefully encourage others who are listening to at least spark some interest to join us. But we already have many of the pieces that we need to unite the network and to drive systemic change. So we've got strong leadership from the CDC Foundation and OHSU. We've got great support from our partners like the Vitamix Foundation. We've worked together, and Kent, you alluded to what we accomplished in our convenings. We've worked together to develop a shared mission, to identify those clear priorities. We regularly check in to see which partners might be missing and have opportunities for folks to join us as they're interested and are able. We talk about things like how we want to communicate, how do we want to organize around our goals, and then we check in on what we decided the last time to continuously improve. And I'll say, because of this really solid foundation that we've built and we've invested the time in pouring, we're really, again, well positioned to make change already. And of course, there are really concrete strategies that we could, mobilize around the sexy things. Like, what is our joint policy advocacy that we want to go after? Or, we could unite around something, Krista, hearing you and just also knowing about a lot of work that goes on across the country where there's community-based organizations that are really doing the work. Like, how do we unite around making sure that the resources are going to those places that are actually impacting family lives day to day, right? So we have those really tangible, exciting things that folks, want to unite around. But I also want to bring something up that's less exciting, and this comes from my experience in really supporting systems change in maternal and child health. It's this culture of patience and persistence across the network. If we can cultivate that, I think we'll be really successful in the long term, because we know systems change is super slow, could take 10, 20 years to really see that change. And sometimes, as a part of the network, we may not be a part of the network when the big impactful change is made. So that's one piece, just being realistic and normalizing that as the way systems change and impactful work happens. It's messy, so we have a success and then we, experience a challenge and we go 2 steps forward, 1 step back, sometimes 5 step backs. But it really can feel overwhelming. It is really complicated. And I've kind of trained myself to view those feelings as a signal that we're on the right track. Like, if you're feeling all these things, that means you're doing the messy work that needs to be done in order to do like this big systems change work that we're really trying to do. So if as a network we can just cultivate that shared understanding that we need to have a sustained focus, if we cultivate a culture where we celebrate our small wins, just to consistently feed our momentum and our energy, if we can commit to all continuing to show up, again, even when that progress feels really slow or like we've stalled, I do think that mindset and continuously bringing it up, that's normal, and just embracing the complexities, sticking with it through thick and thin. It's kind of starting to sound like a marriage, right? I think that this is what is going to really be the glue that holds us all together, along with, of course, all of those, shared mission, that exciting strategic initiative that we choose to kind of coalesce around.
Anna, I was seeing lots of hearts and thumbs up floating up the screen as you were talking. So I think your comments about just, I think, the messiness of system change, but like really, really valuing being in that space is appreciated. So thank you. I wanted to also ask you, Kent, about how partners outside the traditional health and nutrition sectors, like business or local government, how they can best contribute to collaborative action opportunities.
Yeah, that's a very good question. And we've discovered at the Moore Institute in Oregon that we need to have the government align with the kinds of goals that we have for improving health of people in rural communities. And by the way, in our state and in many other states, it's the rural communities who are suffering these chronic diseases more than people that live in urban areas. Now, this is not always true, but we really believe that we need to enlist local businesses, chambers of commerce, local hospitals, and state people who are interested in the health of the population in our state. We have recruited people from all of those groups, and we need to even do more of it, because I think what we often don't remember is that people live in communities, and in those communities, it's the culture of those communities, the environment that they live in, the nutritional environment, the stress environment, etc., that make a difference on whether those people will be healthy and will have healthy children. So if we can address this at the community level, I think we will make a lot of progress. And this is something we could talk about, of how this can be done across the country.
Thank you. Before we get to some questions from the audience, I wanted to give people some information. I'm hoping that some of you are now curious. I hope many of you are now curious about how you can get connected with the Hunger, Nutrition, and Health in Pregnancy Action Network. So let me tell you a few ways, and we're also going to post that in the chat so you can grab it as well. So one is we have a LinkedIn group, and you can search for that on LinkedIn with the name Hunger, Nutrition, and Health in Pregnancy Action Network. Look for it there. We'd love to have more members join there. It's an open network. We share resources. If you are interested in joining, we have a Google group where we can all communicate. Please send an email to us at impacthunger@cdcfoundation.org, and we will give you the ways that you can, the instructions for joining that group. And then also exciting and coming up is to join our quarterly Action Network meeting that will be on Wednesday, September 3rd at 3 p.m. Eastern. So again, send us an email at impacthunger@cdcfoundation.org, and we will make sure that you get an invitation and an announcement when we have our registration open. We've had a couple comments and questions, and I wanted to throw those out to the group. Kent, I don't know that you can answer this in 1 minute, so I'm wondering if this is something that we could. I'm sure if anyone could, you could, but it's a lot. If there's any supporting information you might give us that we can send out to the audience, and that was your comment on poor nutritional health before birth is responsible for such a high percentage of chronic diseases. Is there any more that you would say about that in a very, short 1 minute, that we could give the audience, knowing that we can also direct them to more resources?
Well, no, we need to direct them to resources, and I'd be glad to make those available.
Awesome. We'll do that. Okay, great. Here's also a question that's a little specific, but I just will throw this out too. And I think, Kent, you might have a thought relating how seafood fits into the nutritional requirements and well-being of pregnant people and baby. Anything you would want to elaborate on that?
Yes, I could talk for a long time, but let me say that seafood is healthy. And especially oily fishes during times of fetal development are incredibly important for brain and cardiovascular development. So somebody who's asking that question is on the right track.
Fantastic. Well, we are 3 minutes to our ending here. I don't know that we have any other questions. I'm not seeing any others that have come in. So first of all, again, thank you to anyone who sent us a question. We appreciated that. And if you do still have a question, send it in and we'll do our best to answer that afterward. I want to again thank our panelists today. Anna, Krista, Kent, thank you so much for being here. Please join us for our next webinar, which will be on August 20th, same time, same place. You can register at impacthunger.org. You should have in the chat ways that you can get connected with the Hunger, Nutrition, and Health and Pregnancy Action Network. We really recommend and welcome more involvement. So please come get involved. And lastly, a survey is going to pop up when you leave the meeting. And so please take a moment and let us know about your experience today, what would be helpful for you to see and hear during these conversations. One more thing before folks leave, if you're able to, if there's one thing you're going to do this week because of what you learned today, could you share that in the chat with us, please? We love to hear about that. Is there one thing that you're going to do this week because of what you learned today? We'd love to hear about that. And we also love to hear from you in our evaluations. So that is all we have for today. We're so, again, grateful to have you here joining us. Please join us again. And I hope you all have a great rest of the week. Thank you so much. Bye-bye.
Bye.